Every business that employs or has contact with people carries some risk of being exposed to the hazards of blood-borne pathogens. OSHA has established a guideline to protect workers who, as a result of doing their job, could come in contact with blood or other potentially infectious material. Exposure incidents. What is an exposure incident? An exposure incident includes any accident, injury, or near miss that occurs that has the potential to result in the exposure to human body fluids, tissues, or other potentially infectious materials. OSHA's definition of an occupational exposure: a reasonably anticipated skin, eye, mucous membrane, or skin puncture contact with blood, semen, vaginal secretions, cerebrospinal fluid, or amniotic fluid that may result from job performance of an employee's duties, such as needle sticks, human bites, cuts and abrasions, blood contact, or other potentially infectious materials. Common causes of exposure. Blood-borne pathogens are transmitted when contaminated blood or body fluids enter the body of another person. This can occur through a number of pathways, such as an accidental puncture by a sharp object contaminated with the pathogen. Sharps include objects such as needles, scalpels, broken glass, razor blades. Open cuts or skin abrasions coming in contact with contaminated blood or body fluids, sexual contact. Indirect transmission, a person touches, dried, or caked on blood and then touches the eyes, mouth, nose, or an open cut, HBV only. Engineering and work practice controls. Eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses are prohibited in work areas where there's a reasonable likelihood of occupational exposure. Food and drink shall not be kept in refrigerators, freezers, shelves, cabinets, or on countertops, or bench tops where blood or other potentially infectious materials are present. All procedures involving blood or other potentially infectious materials shall be performed in such a manner as to minimize splashing, spraying, spattering, and generation of droplets of these substances. Wash your hands and any other skin with soap and water, or flush mucous membranes with water immediately or as soon as feasible, following contact of such body areas with blood or other potentially infectious materials. Never pick up items like broken glass with your bare hands. Always wear appropriate personal protective items such as gloves, eye protection, etc. If an exposure occurs. If an exposure occurs involving a needle stick or other potential exposure to a blood-borne pathogen, number 1, stop what you are doing. 2, cleanse the wound and surrounding area with soap and water for a needle stick, or flush eyes, nose, or mouth with plentiful amounts of tap water for a splash to the face. 3, immediately report it to your supervisor. 4, seek immediate medical attention. Your supervisor will need the following information: date and time of exposure, job duty or procedure being performed at the time of the incident, detailed description of the incident including specific information such as which safety devices were being used, the amount and type of fluid, method of exposure, and extent and duration of contact, decontamination procedures used. It is vital that you report the exposure in order to receive medical attention and evaluation. This evaluation will be performed by a licensed physician or another appropriately trained and licensed healthcare professional. Needle stick injuries. What are needle stick injuries? Needle stick injuries are wounds caused by needles that accidentally puncture the skin. Needle stick injuries are a hazard for people who work with hypodermic syringes and other needle equipment. These injuries can occur at any time when people use, disassemble, or dispose of needles. When not disposed of properly, needles can become concealed in linen or garbage and injure other workers who encounter them unexpectedly. If you suffer an accidental contaminated needle stick injury, you should immediately wash the wound thoroughly with soap and water and then report it to your supervisor. Do not hesitate. Universal precautions require that all blood and other body fluids be treated as though they were contagious. In the wake of a needle stick injury, your employer should provide you with post-exposure prophylaxis in an effort to prevent your contracting HIV. Several tests also need to be conducted. Such tests may have to be done at intervals over a period of several months to make sure that your needle stick injury does not lead to HIV, hepatitis B, HBV, hepatitis C, HCV, or any of approximately 20 other blood-borne diseases.